The program started actually in 1986, and the goal of the program was to train obstetrician gynecologists in Ghana who would stay in Ghana and practice in Ghana. It was very Ghanaian driven, so there were Ghanaian faculty, there were Ghanaian leaders at the two medical schools in Ghana, and it was their program. So they took what they'd liked from the American system, they took what they'd liked from the British system, and they combined it into something that was uniquely Ghanaian. When the program was initiated, the plan was that the doctors in their 5th year of training, this was a 5-year training program, and in the 5th year they would come to do 3 to 4 months of training. And the idea was that they could see the high technology, they could see the equipment that wasn't available to them, and they would get help in finishing up their case books and the work that they needed to do in order to sit for their examination. So it was kind of a topping off period. And in the early years, people went to Hopkins and Michigan and St. Louis and Northwestern and places in the United Kingdom. But as people at those places have become less involved with that, kind of the major place now that people come to the United States is Michigan. Isaac, who's one of the residents who's here with us now, who actually has finished his case book, and when he goes back in April, so 6 months from now, he's going to be sitting and taking his boards.
I first heard about the program in the year 2002 when some of my senior colleagues came down here for their external rotation. And when they came back to Ghana, they told us a lot about this program and how they learned by coming to University of Michigan. They told me a lot about some of the surgeries that are done here which are not done in Ghana, especially laparoscopic surgery. And there are a lot of advancement when it comes to laparoscopic surgeries in this university that they told us about. And this sort of appealed to me. That's why I decided to come and learn a lot.
If you really want to create long-term change, if you want to develop human resource capacity and infrastructure, it takes 10 or 12 years, especially in countries like Africa where there's not very much to begin with. So at the end of 10 years of this program, there had been 37 OBGYNs who had trained in Ghana, had completed the training program, had passed their boards because they then took a local examination. And of those, all but one were still practicing in Ghana. And since then, so now we're talking 86, we're talking almost 20 years, the program is now self-sustaining. It's run entirely by the Ministry of Health. And there are about 60 people now who have finished the program.
As at now, there is no subspecialty in my country such as gynecology. It is done basically by the general surgeons, and because of that, the details of this practice are lost. That's why I'm really interested in with what I will learn here. I'll go back and try and see if I could impute some details when it comes to oncology. And that's also the reason why I want to go further and specialize in this subspecialty. And I think it is going to help my country a lot.
I mean, people are proud of this program. I think that when you speak to Isaac and when you speak to other people, you'll see that this is something they're proud of and that they have ownership of. And they want to see it continue. They want to see it be successful.
I've been very happy working with the people that I work with. They are all friendly, and I've enjoyed working with them now. And I think it's a good thing. It's a good testimony about the hospital. And I think I will never forget University of Michigan in my life.